Hoy, Sherika.
Sir,
Lead us to prayer.
okay. Dear God, thank you for this wonderful day. Thank you for you have given us. Please guide us in everything that we do. And please give us wisdom and knowledge to understand our subject today. Amen.
Amen. Father, Son, Holy Spirit. Amen. All right. Good morning, everybody. This will be our second um, discussion, chapter 2 of our discussion. Kuwan siya, health records. So, introduction of health records. But before that, I'll be checking your attendance. Insert. Anong date niya yan? 22. Aguhar, Alvarez. Wala pa si Alvarez, no? Asma. Avila. Di ba si Avila, wala po naminaw. Banluta. Bayakag. Cañete. Coronado. Cortez.
Present, sir.
Dalisay. Delgado. Dinero. Evangelista. Ay, wala no. Okay. Fernandez. Ferraris.
Center.
Sherika.
Present, sir.
Tulanes. Nicolas.
Present, sir.
Perez. Kia. Ebaila. Surigao. Talo. Tugonon.
Present, sir. Talo.
Yes. Tugonon. Wala. Alright. So, tell me ha kung maot akong reception kay ay hinay akong internet karon, hinay man si Sky diri sa among balay karon. So, just tell me kung ano ba ko, robot na ba ko or something kay
Yes, sir.
kanang kuan hinay siya. I don't know. Dugay kay siya.
Sir,
Yes. Kaniya.
si Kabagti daw, sir.
Bakit? Sige.
Wala na tawag.
Sir.
Wala, anong wala man ka?
Ito, tulog
Dahil siya sa...
sir.
Hala, wala ka bagti ko diri.
Ako mga nag-lead last time, sir. Tawag mo ito mo.
Gani basal. Hala, wala ka diri sa
Gi-attendance ko nimo last time, sir.
itawag na lang ka girl, pero wala ka diri sa kuan. Kabagti, no? Wala jud ka diri sa listahan, day. 24 lang ka buok.
Asa dahil ko, sir?
Hala ka.
Pero 26 good to be for, sir, na siguridohan na wala na-appeal dira sa list.
Kinsa pa?
Na-appeal gani ko sa grouping, sir.
Apil kay ka sa groupings pero wala ka diri sa official list ng kuan IT Elective 2 3B. Wala ka mo man tong tanan, di ba? Mao ning tanan no. Kasi
Tanan, sir.
wala ka sa groupings na to, Jeno.
Na naman tanan, sir. Aray.
Paminawa ha, Aguhar, Alvarez, Asma, Avila, Baluta, Bayakag, Cañete, Coronado, Cortez, Dalisay, Delgado, Dinero, Evangelista, Fernandez, Ferraris, Genevea, Villanes, Nicolas, Perez, Pia, Ribaila, Surigao, Talo, Togonon.
Ay, sir, si Delgado.
Delgado.
Hmm.
Si Delgado. Kinsa pa
Oo,
wala?
sir.
Wait lang. Miras. Wala, si Miras. Atay. So, wala si Miras at saka si
Voters.
Miras o si kinsa to kabagti. Wala, nga naman ni. Hindi mo officially enrolled, girl. Hoy, babaji.
Yes, sir.
Kasi hindi ka officially enrolled, ha?
Ano man na, sir?
Oh, ikaw
Lalakad.
na.
Sir, na-adyo ko dira, sir.
Wala, ganun ka. Wala ka sa listahan. Tabi-tabi pa man ang kaganina. Hindi kailangan sa kiri.
Yata ka, sir.
Pwede niya.
Ako, pag-atay ka ro. Ikaw doon ka daw ka. Habo ako.
Ate na, i-chat lang ako mga learn tech. Masig na ako pangalan dito ba? Nasaag.
Sige, sige. I'll just inform si Sir Kuan mo also si Sir si tawag ani. Si Sir Ian. Nga nung wala mo sa Kuan. Sa list sa UIC nga Kuan.
Giyatay, Jed.
Oo, giatay. Di ko siya sa una bago ako. Nilipay ko siya dyan, no? Alright, so let's begin with
Jen, ay katawa na, Jen.
this. Gipahalay pa ko sa akong mama. Walay sandron, girl. Pahipuso
Sir,
na pud
bitaw, sir. Promise.
pahipuso na pud kaana sa imong mama kay walay san.
Mawala na po po niya, sir. Kita hipusin man.
Wala, ngatik na pud ka ha.
Wala ko na nga text, sir. Gosh, yun.
Sige, let's begin with our discussion. So, Julius, si Sanina, ay na, wala pa man si Julius. Si Cañete na, ano no? Cañete. Wait lang, Bi, manghihi sa kudaan, Bi. Para tuloy-tuloy. Lang. All right. So our topic for today is about health records. So we last time we already have an idea of what um kuan health information management is, 'di ba? So again, kinsa gina-manage niya sa health information management, of course, the information coming from different health related systems. Again, dili lang na siya isa ka system, no? Dili lang ang information coming from one system ang gina-manage sa health information manager. But it is the kanang institution-wide information systems. So katong mga systems used in different departments that has something to do with the health information. So okay, remember that lahi-lahi na sila og tawag nito. Dahil ang isa ka patient ang mga information niya kay nana siya, gina-process na siya in different departments. Say for example, sa laboratory results nga, encoding of laboratory results ng isang patient. So na ay department for that will take care of it. Na ay sa doctor na side, no? Na ay dito sa pharmacy sa pag-distribute ng tambal, and even in the kanang kuan nga billing sections na ako'y lahi na dito na information systems used. So again, ang managing of health information is kanang gikan sa the information nga nakuha ato is not only from one system but to kanang interrelated systems, no? And health information system is actually a profession, no? Another profession allied sa kanang kuan sa kanang IT, sa um, health nga professions such as sa katong doctors nga, sa mga nurses and other kanang kuan niya kanang related courses niya. So mura na siya og kanang kuan ba kanang tawag na kanang bridge or between the IT o sa health profession ba. So naa ganin, that's why naatay a degree offered in health information management. And there are certifications as well. All right? So now we'll be discussing the health record. So the health record is the principal repository or storage place for data and information about the healthcare services provided to an individual patient or sa lahi na to na patient. It documents the who, what, when, where, why, and how of patient care. So everything with regards to taking care of the patient, so ibig sabihin, providing medications, no, doing some operations, no, conducting some tests, everything na naay related to providing care or giving care to the patients kay mao nang ibutang nato sa atuang health record. So health records the health records kanang naa dito makita ang status of the patients, na naa dito makita ang status sa ato ang patient. So other names of health record, so natay patient's record, no? So commonly used na siya sa mga hospitals na that caters inpatients, no? So ibig sabihin kitong mga admitted na pasyente, so commonly ang tawag nila sa health record ng isang pasyente is patient record. Alright? Then we have also medical records. So physicians and other personnel typically use this term. So mauna siya kanang pinaka-common in all kanang kanang health-related professions. Ang tawag nila sa health record is a medical record. Then we have the resident records as well. So unsa man na siya? These are patients admitted sa kanang in a long-term facilities. Ibig sabihin, dugay na silang admitted for sa isa ka hospital for kay ning undergo silang mga medications for longer time, no? Pang kuan siya, pang matagalan na treatment ang gi-undergo ng isang patient. So ang tawag sa iyang medical health record is the resident records, no? So resident record siya. Then we have also the client records. So a client records naman kay kuan siya. These are patients admitted in the facilities that kanang provide kuan behavioral and health services. So kung pansinin niyo kanang naa kay common katong sa kanang tawag nito mga psychiatrist, mga and even social workers nga ang tawag sa ilang mga pasyente kay client na nila. So kana siya. So client records pod ang tawag siya. Basta it has something to do with behavioral health services. Na lahi na pod ang tawag. And then we have the charts. So usually kung may ta chart, these are paper-based health records. So common ako ni siya na encounter kana ganing mga records sa mga bata, no? Kanang mga kuan nila kanang mga injections kanang sa ilahang bakuna, vaccines. So na-remember na ko chart ang tawag ato sa ato nila. So kada siya basta paper-based health records. So, it is called chart. So these are other names ng health record used by different professions and katong lahi-lahi nga department. So lahi po ang tawag sa iya. Alright? So regardless of their names, its primary function lang man is to document and support the patient care services. So mao man jud ang iyang ultimate purpose is to document ang mga services na gi-provide ng isang healthcare providers to their patients. So mao jud na ang iyang ultimate purpose, i-document. Alright? So, today daw, the management of health record systems and services is the primary responsibility of our health information management. So, we have data versus information. So, this is common nga in an information management. So, let's define data in a concept of kanang kuan health records, no? So these can be collected in a form of dates, numerical measurements, and statistics. So probably these are kanang results in the test, or laboratory test, textual descriptions, checklist, images, and symbols. So kato sila refers to our data. And information naman, data that are being analyzed and converted into specific purpose. So kung may tag specific purpose, so ibig sabihin, these are kanang generated result that answers specific inquiry ng isang kanang user. So for example, si administrator ba karon dapat kanang kuan niya, kuhaon niya ang status ng bed capacity niya karon, no, or katong mga available beds. So, kana siya for specific purpose na siya. Results for specific purpose. And that is an information na. Remember that in the concept of our information management, kay kuan siya. A data that is being processed, so that becomes an information. All right? So data represent facts and information represent meanings. So information actually provides additional meaning to our kanang kuan, to our kanang health records na health records or patients information na to. So again, ang meaning depends on the user. Kay pwede man ang isa ka information kay kuan siya kanang importante siya to a specific user pero kuan na siya, walay pulos na siya kung tan-awon sa uban. So the kanang kasi tawagan na kanang value of that information and that depends on the user. All right? So daily always na ang information produced kay kuha na siya kanang beneficial to everyone, kanang of value to everybody. So valuable lang na siya to the a user that needs it or that uses it, no? And that should be the concept talaga ng isang information system. So, ang i-provide lang ay information management. So, ang i-provide lang na information to a specific user kay kanto lang kung beneficial sa iyang part. So, that's part of the management nato. So, an electronic health, so, kuan, that the traditional practice of the health record management was based on the collection of data in paper forms stored in paper folders. So mao na ang traditional na ay papel, gisulat dito sa papel ang health record ng isang patient tapos gibutang na siya sa filing cabinet makaron sa folder. So and even up to now mo na usually ginagamit sa mga small clinics, no? So, ingon ana ang ginatrabaho. But with the advancement of technology, slowly nagakuan na karon. Naga-shift na ang pag-records ng atoang health information. So, naay duha ka systems that are being used in recording our health information. So naatay AHR at saka PHR. So electronic health record or EHR systems, kay these are systems na electronically collects, stores, and analyzes kanang health information created and maintained in interactive way. So, kana siya, mo ng AHR. So, ang PHR naman has been used to describe a health record initiated and maintained by an individual. Anong ibig sabihin nito? That ang PHR, ang user ng information is actually the patient. So, siya ang mag-record, siyang mag-store, siyang mag-maintain ng personal health information nato. So, kita mismo, no? Kita mismo. So, unlike with an electronic health record or EHR, this is it sa end naman ito ng mga healthcare providers. For example, mga hospitals. So, katong mga information systems na installed in a hospital, so mo itong mga electronic health record systems na to. So, who maintain and uses it, of course, the health institution. Unlike with the PHR, si PHR nga kay ang user ato kita. So, katong mga patients ang user ato. So, PHR daw has, of course, naana siya kanang duha ka klase. So, the PHR are categorized into paper-based PHRs and electronic PHR. So paper-based PHR contain files. These are files containing information from doctors, insurance companies, pharmacies, hospitals, and other healthcare entities that patient keep around their homes. So, anong ibig sabihin nito? Kadto na siyang mga resulta sa mga mga check-ups ba karon, no? Mga insurance companies, mga reseta, itong mga medical records gikan sa hospitals and everything, tapos gi-keep siya sa inyuhang balay, gitago siya sa inyuhang mama. Itong mga charts na to, gikan sa inyong pagkabata, itong inyong mga timbang, mga bakuna, kano sa mong ipakunahan and everything. So, mo to siya mga paper-based PHRs ninyo. An electronic PHR naman contains the complete health history of an individual and is accessible online to anyone that has been given access by the individual. So, kuan kanang kung electronic, so of course, this is kanang computer-based information systems. But again, who records, kay PHR man siya, who records the information, it is the patient. That is why it is not very common among us. Kay kanang unang-una, wala kaayo'y nag-offer ng mga information systems or let's say for example, web-based system ba karon na na kanang wala kayo nag-offer o yun ana na service nga allows kanang patients to record its own tawag nito kanang health record or information. And besides, it's hassle for the patient, no? Kay unang-una sa mga vocabulary pa lang nagigamit dito sa medical records nimo, wala nakakasabot, no? Wala kakasabot. So it is difficult for you to kuan to write your own medical information kay ang nakasulat sa imong medical records kay wala na din kakasabot kay technical terms man ang naa dito. Diba? So murag dili kayo siya kuan ba sa pantanaw sa isang pasyente, so dili kayo siya ingon ana ka importante. And besides naman poy health record ang isa ka hospital. Ato that is why it is nga very advisable na kung asa imuhang doctor dito jud ka mabalik-balik because the doctor knows kung unsa jud to yung medical history kinahanglan siya record ato. So in an electronic PHR, it is further subcategorized into two. So we have the personal computer-based PHR at saka mga web-based PHR. So the personal computer-based PHR are created by patients on their personal computers by typing or scanning their personal health information into generic software or into a specific PHR applications. A simple collection of all the medical records nimo kay na siya. Personal computer-based PHR na siya. Even wala ka nagamit og system, ipang scan lang daw na nimo, ipang type lang na nimo sa Word or whatever, so that is your PHR na. Yun nga, dili dyan na siya yun anak ka kanang kuan. Wala dyan ay dili jud kaayo na siya practiced, no? Dili jud na siya practiced kaayo. So, now po web-based PHR allow patients to maintain their personal health information in private online accounts that provide around-the-clock access from any internet-connected service, no? Or devices, sorry. And it's sometimes called patient portals. So, what's good with this kay kung web-based PHR, pwede man good nimo kung everyone has its own portal, no? Kay siya mag-record dito, pwede na niya i-share to kanang doctors ba karon, to other doctors ang katong ang iyahang health record. So pwede niyang i-share sa iyang mga doctors ang katong iyang health record coming from previous kanang kuan niya for a health information, no? Kana pero again ang PHR man good kay there's no legal mandate to maintain it. So ibig sabihin kung walay legal mandate, so walay mo check sa iyang um, correctness, 'di ba? Walay mo evaluate kung tama ba 'to ang iyang mga gipangsulat, walay mo mo unsay tawag na quality assurance ba kanang QA sa iyang kung unsa man tong mga gipangsulat na to. So ibig sabihin kanang dili kayo siya reliable. No, unlike with si AHR manggod, no, kay from hospital, ang hospital has legal mandates jud to kanang kuan to record the patient's information. So ibig sabihin, it is required by law to kuan to have health information record. No, so ibig sabihin kay requirement to, there should be kanang integrity check, kanang mga quality check and all for the health record, no? And in that way kinamay legal obligations kay dapat tama jud dapat everything is correct jud dapat dito. Thus mo jud to siya ginabasihan um, sa mga physicians or healthcare providers. So medyo in an absence of quality assurance man gud sa PHR, hadlok kung mo siya basis, tagaan basis for nakuan for the kanang healthcare providers. No, kung manually gina-type lang, unless gina-upload ang images, gina-scan ang image, tapos gina-upload, kana siya, posible pa na, pero kung manually i-transcribe ng isang kanang kuan, i-transcribe ng isang patient, kung unsa may naa dito siyang record, medyo malabo, dili kayo siya ginatagaan emphasis sa mga healthcare providers kanyang tanawan. Unless, again, it is being scanned. Then upload, di mo dito. So PHR versus AHR. So AHRs are electronic systems designed for healthcare providers to use. Again, AHR, kay ang mugamit ana niya are mga healthcare providers or katong mga healthcare institutions that offer services to patients. Services, pwedeng katong mga inpatient services o outpatient services. So, pwedeng kanang sa outpatient, pwedeng laboratory lang, pwedeng check-up, no? While sa katong inpatient, kato na itong mga na-hospitalized sa kanang institution. It support the providers for the legal mandate of documenting the care given to the patient. This is what I already have mentioned kanina, that healthcare institution are mandated to document the care given to the patients, no? So kung unsa may gibuhat nimo nga pag-asikaso sa pasyente, gina-record niya dito. Ibig sabihin, with the medications, iyang symptoms, iyang medications, iyang diagnosis, iyang kanang mga test results, everything kay documented na dito sa institution na healthcare providers nato. And one way to document it, is the EHR nato. With the PHR naman, same lang yapon, these are electronic systems designed for patients to use. So, it is a non-required, so dili required, patient-centric healthcare delivery model. So, ibig sabihin, patient-centric. So, the maintenance, no, of the health record kay naa na siya sa atuang mga pasyente nga nag-fall. But then again, it is not required. Why it is not required? Because there's no legal mandate na you as the patient will document your information, health information. Pero kailangan jud pud na nimo siya, no? It is kanang it should be it is necessary really to have your own medical records kept sa inyong mga balay or tukuan kay kung na mga emergencies you can easily bring it, di ba? Unlike with kung layo dahil ang imuhang hospital or layo imuhang doktor niya, kana lang ang doktor ang nakabalo sa imong medical records. So, natiuro ka. While kung naka, nag-keep ka sa imong balay, there are emergencies, so dadun lang to nimo, then you will go to your nearest hospital. Di ba? Kana mga ganaan. So, it is really, though not required, but it is important to keep your medical informations, no, personal medical informations, and you should be the one maintaining it as well. So there are kanang purposes of health information management. Na primary purpose o secondary purposes. Primary purposes and secondary purposes. So in a primary purpose, purpose or purposes, these are kanang kuan associated directly with the provisions of patient care services as well as the documentations of the patient's health status. Diba, mingon man ta, the ultimate or the major purpose ng isang health record is to document man the services provided by the healthcare by the healthcare providers na provided by providers to the patient niya. So, associated directly with the provisions of patient care nga as well as the documentations of the patient health status. So, gina further sub kuan niya kanang divide kato na purpose na ni. So, the first is for the patient delivery. So, patient care delivery, it has, of course, has something to do with the patient na to. So, healthcare record documentations daw helps physicians, nurses, and other clinical care professionals to make informed decisions about diagnosis and treatment. So, with you having your medical records, so mas madali for the physicians and other healthcare professionals to create good decisions about diagnosis and treatments nimo kay kompleto man ang imuhang medical records. Also, health record is a tool for communications among individual patients and different caregivers. So, 'di ba, kanang in order for 'di ba kung nakay daghan nga doctors, no? Kung wala ang ubang doctors nimo, kung kita kay wala kay sometimes 'di ba the common practice for doctors, especially kung admitted ka na lahi-lahi ang kung complicated imuhang sakit, so lahi-lahi jud na siya mga doctors assigned sa imuha depending on their expertise na sa heart, na sa kidney or so whatever, daghan kang mga klase-klase ng doctors. So the common way is for them to have conference para ma-orient ang kanang doctors sa kung unsa man ang kanang sakit nimo in specific or kanang organs or what. Pero in an absent of some, kay pwede nang tan-awon dito, nakabase dito sa imong medical records. So that is why it is nga mentioned nga ang in a patient care delivery kay ang health record kay kuan siya is a communication tools among individual patients and different caregivers nga kay dito man masabtan man na ni doctor, ni other doctor nga mao dai ni ang sakit ni ni pasyente. Mo dahil ni ang situation sa iyang heart, mo dahil ni situation sa iyang kidney. Ayun, anya. So, kana siya. Effective communication nga daw ensures continuity of patient's service. Which is true. Kay with the health records ng isang pasyente, tanawon dito o makita man ang mga things or cares na kailangan ni pasyente. So with that, makuan, identify kung unsa pa tong need to provide sa imuha. So aside from that, sa patient care delivery gapon, so health records allow health professionals to assess and manage risk. Also, yung health record represents legal evidence of the service received by the individual patient and represent the business record of an organization. So, anong ibig sabihin nito? That kanang kuan na siya, kanang ang health record serves as evidence na siya sa mga pasyente nga mauni ang mga services being provided ng mga health institution sa iyaha. So, kung na may malpractice nga mahitabo, so ma-identify lang na siya na naay malpractice or ma-identify lang na siya nga naay mga mali nga diagnosis base sa medical records. Diba? So, it serves as evidence. As well as, sa point of view naman ng isang health institution, health providers, kay kuha na niya business records na niya, no? Business record na niya sa iya nga end. So unsa man to na mga kuan to document services received, example daw ana niya. So to constitute proof of identity, to self-manage care and to verify billing. Because part man good sa kanang tawag nito, reimbursement man ang tawag, kanilang magbayad ka sa imong hospital bills. Actually reimbursement na siya. Kay unsa may reimbursement, di ba? Murag kanang naay na nahatag or naay something tapos i-reimburse nimo, kambyuan nimo murag something like that man, di ba? That's reimbursement. Gano man, actually wala nimo gipalit ang service. Kung ay naay service nga gihatag sa imo, so imo tong kambyuan, imo tong bayaran in monetary unit, so that is reimbursement. So ang billing actually is ang tawag atong sa health institution kay reimbursement systems to sa. Alright, kanang mga billing information system. Reimbursement kay naay gihatag sa pasyente na service, so i-reimburse lang to siya. Kambyuan lang to siya og monetary unit. So ang health records ng isang pasyente, ang reimbursement nakabase man or ang bill nakabase man sa mga service na provide ng health institution. So for example, ay dito siya sa exclusive room, no? Kaya mga yun air-conditioned room, nabutang siya dito. So that's part of the kanang service provided by the health institution. Natagaan siya kaning inun-ani ng mga medications, undergo siya inun-ani ng mga laboratory test, mo aning mga doctors nga ming cater sa iyaha. So that's part of the health record. And dito ang basihan sa ato ang reimbursement of the service provided by the hospitals or the providers. Tapos, so again, si patient care delivery, kuan dyan na siya, documenting the physicians and other professionals in making informed decisions and everything. So, ang main focus jud ato kay providing service to the patient, no? Paghatag or pag-deliver og kanang services sa pasyente. Tapos patient care delivery sa provider side naman. So to foster continuity of care, to describe diseases and causes, no, to support decision making, tapos to assess and manage risk for individual patients and many others. So ang duha ang viewpoints ng patient care delivery sa patient side at saka sa provider side niya. Then we have the patient care management. So sa patient care management naman daw refers to all activities related to managing the healthcare services provided to patient. So, lahi ang patient care delivery o patient care management ha. Patient care delivery, katong mga services being offered or given to the patient. Kani naman patient care management is kanang activities nga gina-perform to manage the healthcare services to patient. So, health records assist providers now in analyzing various illness, formulating practice guidelines, and evaluating the quality of care. Even ang evaluation of the care given to kuan to patients kay appeal na siya sa patient care management. To document, so unsa may na dito, to document case mix in institutions and practices, to analyze the severity of the illness, not to formulate practice guidelines, so to manage risk, to characterize the use of services, to provide the basis for utilizations review, to perform quality assurance, kana siya, so part of the management of the care or services. So, then we have the patient care support. So, patient care support processes naman kay these are activities related to handling of the healthcare organizational resources, no? Analysis of trends and communications of information among different departments naman. So, anong ibig sabihin nun? So, allocations of support. Okay? We cannot provide services or care kung kulang tag resources. So dapat properly allocated ang atuang mga resources in order for us to provide quality service. No? So again, managlahi ang patient care delivery kay ang the actual giving of kanang kanang services, no, health services. Ang patient care management kay pag-manage sa paghatag og service. Kanina man sa patient care support kay pag-allocate ng resources, no? Pag-analyze ng mga trends and develop forecast, to assess the workload ng mga nurses, workload ng doctors, and many others. And communication nga among departments. So support na siya. It's the support. Then we have the financial and other administrative process. So, the health records naman in this case, determines the payment that the provider will receive in every type of reimbursement system. So, kay financial man siya. So, as I have mentioned kaganina, a while ago, that with the health record, siya yung basis nato to compute for our bills. So, in health record, data elements, mga assistance given, no, and managing given kay ginagamit na siya sa pag-report ng mga cost incurred during the service nga gihatag. So, documenting service for payments. So, it's part of the financial and other administrative process. The bill for service. The submit insurance claim. Okay na mga insurance claim. Adjudicate insurance claim. Kanang mga ganing mga naasa kanang naka-hearing naka-hearing na mga insurance claims, so ginagamit po na siya. To determine disabilities, no, kanang mga compensations, kanang mga ano sa tawag kanang mga kanang pensions, kanang mga yun to manage costs, to report costs, and to perform actuarial analysis. Tawag. Then for the secondary purpose naman, so kay duha man mga secondary purposes. So sa secondary purposes related to the environment in which healthcare services are provided. It does not directly related to specific patient care encounters naman. So, ang primary kay related to healthcare jud sa patient. Kani naman, so basically, ang benefactor ani kay kanang dili directly sa katong sa patient care, na sa patient. So kinsa man to sa educations, sa regulations, no, sa research, public health and homeland security, policy making and support in the industry. So, sa education, so of course, to document the experience ng healthcare professionals, to prepare conferences and presentations, and to teach healthcare students. So, ang health records pwedeng gamiton ng kanang kuan ang tawag nito, pwedeng gamiton ng school karon as kanang case study, no? Muna siya kanang pwedeng gamiton as case study sa ng mga estudyante. So base sa medical records, kung ano niya dito, pwedeng mag-create ng case study ang isang estudyante or ihatag niya sample case study ng isang estudyante. Regulations kay kuan to serve as evidence in litigations. So kanang mga ongoing cases filed in court, so pwede na siyang gamiton as evidence. Post-marketing surveillance, no? Assess compliance with standards of care to accredit professionals in hospitals. So that is what natay mga accrediting bodies. So kanang mga and even mura kog school na concept, di ba, natay mga PAASCO, mga unsa pa ng mga atong mga accreditations na gipang-apply yan. So kung nakapasa ka ana na mga standards na sa ilang standards, ibig sabihin quality and service nga imong gihatag. So kanang mga level 1 PAASCO, level 2, level 3 PAASCO, Center of Excellence, ano may ganas kung sa school. So ibig sabihin nakapasar ka sa ilahang standards. So ibig sabihin quality ang imong gina-provide sa imong mga estudyante. Same goes in the healthcare institution. So kung naay mga healthcare mga accreditation bodies, kung nakapasar sila so ibig sabihin they are providing healthcare quality healthcare services sa mga pasyente. Then it is also used healthcare records are used in research to develop new products, to conduct clinical research, and to assess technology, to study patient outcomes, and many others. So karon nga, there are a lot of studies conducted para i-identify World Health Organizations niya, conducted studies sa katong mga tambal nga pwedeng effective gamiton for kanang COVID-19 patients, kanang mga yun anak, mga infected, treatment, mga possible treatments gihatag. So ang mga results ato are being studied to para makaproduce sila ng isang research output. Public health and homeland security, so to monitor public health and to monitor mga bioterrorism activities. So tanawon po na siya. Let's say for example, based on health records in this specific area, daghan kayong naka-cancer. Ana. So it prompts the healthcare officials, government officials, to investigate nganong sa kanina lugar kay kuan man daghan man kayo nagka-cancer and nagka-skin cancer. So there will be environmental scanning nga mahitabo. Unsa kaya what are kanang possible causes nganong nagkaroon man ng yun ani based on medical records kasi yun ani ang mga nahitabo sa public or something like that. Policy making and support. So policy has something to do with kind of allocating resources and conducting strategic planning ng atuang ng pwedeng ng government nato, ng institution itself, healthcare institution. So, and then the industry to conduct research and development, to plan marketing strategy. So, let's say, for example, for the healthcare industry, ay, daghan kayog mga nangadaot ang kidney, mga kidney patients, mga pang-dialysison. So, na-found out in medical records na daghan. So, ibig sabihin, mutaas pa ang kanang dialysis center industry, no? Daghang mag-build ng mga kanang dialysis centers, no? And marketing strategies po nila sa mga hospitals, no? Mga yun ana. So these are mga secondary purposes of a health record. Morning mga bases. No, ang health records ginakuha na siya as basis in education, regulations, research, health, public health, policy making, and support in the industry. So there are kanang users of health record. Basically, ang users of health record are categorized into two. Individual records of individual users and institutional users. Pareha atong deriba second na primary ug secondary. The primary kay kuan man to kanang katumatong na-direct nga kalambigitan sa patient record. So kinsa may na-direct kalambigitan si patient o si mga healthcare providers niya na apoy katong other institution. So kato to siyang external to katong sa katong patient o sa providers. Sa external nasa gawas. So same as here sa users. Usually katong mga nasa gawas kay mao to siya mga institutions. So sa kanang individual users kay naay mga representatives ng individual users of the healthcare health records. So naay patient care delivery sa provider side o sa same ka ganina patient care delivery sa consumer side. Consumers or sa patient side. So these are individuals who provide patient care services including physicians, nurses, patients, and many others. No, katong directly associated with the healthcare records nga. So mo na silang mga patient care providers. Yes, that's it. Wala ko. Wait lang, mabali. Okay. First, wait lang. Patient care others. Lahi lagi. Wala ko, sorry. All right. Then we have the wala lagi ko. Then we have the patient care management and support. So we have the administrators, financial managers, mga accountants, no, quality managers, record professionals, or mga risk managers, unit clerks, utilization survey managers. So as kuan nga kaganina, as mentioned nga kaganina sa ato ang kanang kuan sa mga purposes of our health records, di ba, na ato'y mga patient care management. So patient care reimbursement, so benefit managers, mga insurance, again, reimbursement has something to do with the billing na to. Mga other accreditors such as kanang kuan. Such as kanang accreditors, government policy makes, legislators, lawyers, na healthcare research and clinical investigators, kana siya. So si patient care management and support staff daw, so these are actually mga individuals who oversee the services provided to patients within their organization. Siya yung naglaga. So as mentioned kaganina, siya yung nagtanaw sa kanang how services are being given to the patients. So kadto sila mga tao. So mao ni siya ang mga ipang mention kaganina. So actually, they are responsible for the overall evaluation of the services provided or rendered to the to the patient in particular area of responsibility ng mga tao na naa sa patient care management and support staff. So sa coding, sa patient care reimbursement or sa atong coding and billing staff nato, so remember that ang staff is responsible for coding and billing staff kaning sa patient care reimbursement. So responsible for healthcare reimbursement. So health records allows coding specialists, so coding specialists ang tawag anang naa sa reimbursement. So to allow to identify the patient's diagnosis, therapeutic procedures, and services received ng mga patient. So using this information, appropriate diagnostic and procedural codes are made. Katong mga codes na to is used to generate the bills. So mao na tong naatay computations of our kanang bill kay kuan man nakabase to siya sa mga diagnosis ng patients, therapeutic procedures, and services received. So mga other people na individuals na naggamit og health records kan employees, di ba? Aside from this, na mga employees, so health record is used to determine the extent and effect of the occupational hazards. It is an obligation, di ba, ng isang employers na kanang to provide, to compensate employees once na ay mahitabo sa ilahaan na dili maayo inside the company. So, para tagaan na sila compensation, ang basis for the compensation now kay kuan kanang depende sa health kuan nimo, record nimo. Alright? So, mo nang kailangan po siya sa mga employers. Sa lawyers, so, health record is considered as legal documentation niya. So, mo na ni kanina pa, ang gina-mention that basis siya for legal document siya. Legal document siya. So, pwede po daw sa mga law enforcers. So, use the HR4 kanang investigations of crimes, di ba? Mao gani nang kung naay something wrong with you, kung naunsa man ka, let's say for example, physically abused ka or what, kailangan dyan mong manguhag medical certificates. Gamiton na siya for investigations. Healthcare research and clinical investigators. So, kuha na siya. Ito ng mga mag-conduct of clinical research. Then we have the government policy makers responsible for evaluating the overall health and well-being of the population they serve. So these are mga individuals no na users of our kanang health record. Kani naman institutional naman. So ibig sabihin katong sa institution nato. So kinsa man to sila? So mga healthcare delivery organizations. So they use data from health records in providing services, evaluating and monitoring the use of resources, seeking reimbursements for the service provided, and planning and marketing services. The mga third-party payers. Kinsa man yung mga third-party payers? So kuha na siya. Mga organizations na siya responsible for the reimbursement of healthcare services covered by some kind of insurance program. Katong nakalikuha kag mga insurance nimo sa kanang for Medicare or kanang mga HMI, mga insurance na medical insurance nga imuhang na-avail. So kato sila mga third party payers to sila. Kasi sila man ang mobayad sa mga services rendered nimo rendered sa imuha kung nakay insurance. Mga research organizations or educational organizations, katong accreditation organizations, that's what I have mentioned kanina. Kung magpa-accredit ka sa mga services provided nimo sa mga empleyado ay sa mga services offered nimo sa mga patients. So tanawon dito sa accrediting body ang mga medical records ng mga pasyente. Also from government licensing agency tanawon pod no ang mga medical records para matagaan og license to operate ba karon no ang isa ka health institution. And policy bodies. So, mga policy bodies, kani sila ang well-craft new laws, no? Mga balaod na posibleng buhaton base sa kung unsa man tong situation sa ato ang public health nato. So again, ma-identify lang ba itong public health when it is kanang check sa kanang every kanang medical record ng isang pasyente. So, mga representative, even the kanang kuan, mga World Health Organizations, kana sila, mga institutions, kana sila, mga DOH, kana sila, institution, mana sila, na ay pwedeng mo access sa health records ng isang pasyente. No, kanang mga Red Cross, kanang blood banks, mga yun ana. So mga healthcare delivery, mga inpatient and outpatients. And many others. So we have the storage of patient care documentation. So ang pag-store, kay maubaya dyan to main purpose, di ba? Mention pa nato. The primary purpose really is to store patient care ng provided by the healthcare service providers. So associated attributes associated with the storage function. So actually na ay mga attributes associated with the storage function. We have the quality, tapos na ay accessibility, security, flexibility, connectivity, and efficiency. So these are mga attributes associated with the storage functions. So mao daw na siya ang mga tawag nito, mga attributes, no? So when we talk about quality, so it depends on the design of the organization, systems and processes for collecting the original information. So ang quality jud nakadepende lang jud na siya sa 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 how system is being designed or iyang function, or how it accepts inputs, di ba? How it process the inputs and how it stores the inputs. So basically, mao jud nakadepende jud ang quality. So anong ibig sabihin nun? Di ba naatay in our systems analysis and design, I don't know if you were able to kanang learn the concept of GIGO nga, garbage in, garbage out. So anong ibig sabihin nun? That when an information systems accept garbage na input, so ibig sabihin ang what is being processed is also garbage. So when the ang input is garbage, ang process garbage, ang output is also garbage. That is why it is very important for an information system na ang pag-capture niya sa data must be filtered, no? Naatay mga kanang gina-check na to ang ato ang input. That's why natin mga validation forms na ginatawag. No, gina-check na to kung tama ba ang mga formats, tama ba ang everything, no, sa ato ang input para basically tama po to siya ang ato ang ma-process kung tama po tong results. So, sa pag-process po, so dapat kung tama na ang ato ang we were able to capture correct data. So dapat ang pag-process po niya correct sad siya. No? So and even ang pag-store sa iya dapat ma-secure siya and everything para there will be no kanang unauthorized manipulations occurs. So basically that's how giving quality patient care documentation is. So another model, the data quality management model na gina-follow. So we have the application. These are factors, no, that are kanang kuan. Anong tawag nito? Kanang factors na siya that affects quality ng isang health record ng isang pasyente. So what are the factors niya? So we have the application, the collections, analysis, and the warehousing. So na ay mga characteristics based on this model na ni, there are actually characteristics also of data quality na accessibility, consistency, currency, granularity, precision, accuracy, comprehensiveness, definition, relevancy, and timeliness. So, unsa man tong mga 4 domains or factors that affects the data quality. No? So, we have the data application, which is katong mga arrows ba kanina. So, data applications kay the purposes for which data are collected. Those refers to kanang purposes for which data are collected. Remember that these applications, these are systems, no? Na naa siya ay mga kanang lahing na purpose why data are collected. Tapos we have the data collection. These are the processes by which data are collected, how data are being collected. So maot na siya ang kuan. So ibig sabihin, halimbawa, the most kanang naidako nga problema of accuracy kay kanang user input nga kanang text fields, naman yun na kanang type kinahanglan i-type. So mo na dako nga problemas in terms of accuracy or data quality kay sa daghan kay pwedeng magkamalian na kay nakadepende na siya sa user sa kung unsa niya pag-type na. So that's why natin mga combo box nga, radio box, text box, kay para to limit the kanang kuan ni user sa pag-type you're providing options. So mopili na lang siya. So para uniform ang inputs ni user. That's why we have that. So that's part of the data collection. Data warehousing naman is the process and systems by which data are archived or saved for future use. So napoy the storage and how it is being stored affects the data quality. And then the data analysis, the processes by which data are translated into information that can be used for designated application. So mao na silang upat, the applications. So katong kung unsa man tong mga softwares gamiton, the collection, how data are being collected, no? Sa kung unsang mga pamaagi, sa unsang data warehousing, sa kung unsang pamaagi gi-store ang data, o sa analysis kung how it is being translated into information, ang pag-process literally sa data. It's actually the data analysis. So, morning mga characteristics of our data quality. Accessibility. So, kung mayroon kang accessibility, so, kuwan siya. Data are easily obtainable. So, anong ibig sabihin? Regardless kung unsang oras, kung asa ka, the data can be accessible, can be used, no? Pwede siyang magamit, can be obtained nga na ginatawag na to. So, that is accessibility. So, we have also consistency. So, kung mayroon ka consistency kay data, consistent siya from karon, from how it is being capture, pag-store niya, pag-process niya, consistent lang gihapon siya as is siya. So, anong ibig sabihin nun? Data do not change no matter how many times or how many ways they are stored, processed, or displayed. Regardless kung kapila, kung unsang pamaagi nimo siya gi-store, kung unsang pamaagi nimo siya gi-capture, kung unsang pamaagi nimo siya gi-process, gi-analyze, consistent lang gihapon siya. It doesn't change at all. So, consistent siya. Currency, so, has something to do with kanang the current data nimo, up-to-date data nimo. So, kuan siya, kanang as much as possible, real-time siya. That's currency. So, especially in medical records. So, dapat, dili jud pwede na kanang delayed ang mga medical records. Kaya, again, basis man to siya in giving health services, di ba? So, dapat real-time or at least man lang real-time. So, that is an up-to-date. So, currency siya. That's currency. Granularity. So, attributes and value of data are defined. So, di ba? Murag sa atong database ba, kanang metadata. So, the attributes, so, katong mga nag-describe ng data, kay kuan siya, properly defined. Example, with the number of kanang number of kanang decimal digits gani for in laboratory results. Let's say, for example, kung pila ba dapat, 2 decimal places ba ang kailangan, 3 decimal places, so on and so forth. So kanang mga yun ana para ma-identify nga this is kay valid something ni siya, valid result or what, kanang mga range na to, kana siya. So dapat granularity, that's the granularity that should be properly defined. Then we have the precisions. So precisions naman has something to do with describe the expected value of the data. So unsa mga precisions kadong mga precise value of the data. So for example, in value ng isang attribute na gender. So a gender, so tulo actually na 3 possible scenario possible value of gender. So, we have our sex makaroon, male, female, at saka unidentified. Kanusa man magkaroon ng mga unidentified? Katong mga fetus makaroon na the gender is unidentified. So, pwedeng ganon, kanang mga ingon ana. So, kanang or kindahay ba karon na ay putol nga lawas dira, wala ang ihang lower body or something like that, or isa ba, basta unidentified, kanang pwedeng something. So basta kanang dili may balaan, or ulo lang ba karon, or kamot lang ang makita, so walay something na makaingon nga this is a girl, this is a boy, or what. So that's unidentified. So that's part of the precision. So ibig sabihin that kanang kuan, ang data quality kay, with the data quality, ang mga values are precise, no? Ang expected values kay mauto siya. Then we have the data accuracy. Of course, kung may accuracy, data are correct. Then comprehensiveness. So ibig sabihin kompleto. Data or information, document kay kuan kana data elements are included in the healthcare records, all. So tanan kompleto. So that's comprehensive, no? Dapat there's no missing information or fields na wala nga kulang. Then we have the definitions. So data or information documented in health records are defined. So na ay gitagaan mo meaning ang mga data or ang information. Lahi siya sa kanang kuan ha, lahi siya sa granularity, kay ang gi-define sa granularity kay the attributes and the value. Kanina man sa definition ang gina-define niya ang data mismo o ang information. Then we have the relevancy. So katong usefulness ng isang data. So kung relevant siya, so na siya quality. Then timeliness, data being recorded at or near the time of the relevant of time of the event or observations. Anong timeliness? Kung ang pag-record nimo sa data kay katong on time. So ibig sabihin at least man lang close to the time that is being being observed. So after nimo gyud observe, automatically you have to record your observations. That's the timeliness na tinatawag. So accessibility, as what I have mentioned kaganina, accessibility, which is part siya sa characteristic of data quality, at the same time attributes po siya associated with the storage function. So yun nga, accessibility is the data are easily obtainable. Security daw is the protection of the privacy of individual and the confidentiality of health record. So when the health record is stored, so dapat there should be security imposed. So kung may security imposed, has something to do with the privacy and the confidentiality. Privacy is defined as the right ng isang individual to control access to their personal health information. So ibig sabihin, do not health record systems, no, regardless kung electronic health record man siya or kanang kuan man siya, PHR man siya, dapat not everyone is given access to the information ng isang patient. So that's privacy. Only those authorized ang tagaag access or privilege to access the health record. Refers to the expectations. Confidentiality naman refers to the expectations that the personal information shared by an individual with a healthcare provider during the course of care will be only for its intended purpose. So basically, privacy confidentiality kay kuan dyan na siya. Kanang has a thin line lang in terms of security. Magkuyog dyan na sila always. No? That's the security. Then another attribute is flexibility. So health records data should be flexible enough to meet the needs of the records different users. So ibig sabihin, pwede siyang magamit sa mga authorized users sa bisang unsang pamahagi sa gamiton di bisang kinsa bas as long as authorized. So ibig sabihin, it is being flexible nga. So, depending on the requirements ng isang user. So, pwede siyang, it will adapt to what are required, no, ng isang user. Connectivity, so refers to the capacity of health record systems to provide electronic communication linkages and allow the exchange of health record data among information systems. Ibig sabihin, there should be data sharing na mahitabo. Sometimes, on what way, di ba? Ma-share nimo ang imong data into others, no? So, pwede to connect one system to another. Kung dili nimo, lalo na especially kung external institution ang mo gamit. So, of course, as part of your security, dili dyan na nimo siya tagaan og direct access to your database, di ba? Ikuan pa lang niya, i-attack pa lang niya ang imong database, no? Intrude pa lang niya. So, the most guwapo na solution is pwedeng tagaan nimo siya og JSON, no? Naka-JSON or XML para dito niya i-access tong mga required data niya, needed data niya. So, from system to another system. Or yun, that's actually providing connectivity. Efficiency, so providing access to health records in best possible manner with the least waste of time and effort. That is efficient. So, gamay lang kag resources na magamit, shorter time, o gamay nga effort nga ma-provide. So, that's efficiency. So, obviously, effective ang imuhang pamaagi, pero at the same time, efficient siya. So, lahi man ng effective o efficient, di ba? Kung effective, it performs what it is intended to do, pero kung unsa man siya kapaspas, no? Kay motong ang kapaspason is an efficiency or something like that. So, natay guidelines in clinical problem solving. So, physicians, nurses, and other caregivers daw use the information in individual health records as the basis for making diagnosis and choosing treatment options. So, a properly formatted health record can guide clinicians through the process of solving clinical problems. So, health record format daw refers to an organization of electronic information sa paper forms with the individual health records. Actually, naay 3 formats: the paper records, the hybrid records, and the electronic records. So, kung ngayon paper records, these are paper-based record systems. So, napoy tulo ka klase sa paper-based. So, papel-papel lang as what mentioned na to kanina. Source-oriented health record format. So, organizes the information according to the patient care department that provide the care. Excuse me. So, actually, mo ni siyang mga paper-based EHR. No, katong health record na kanang kuan. Paper-based nga ginabuhat ni health institution. So, source-oriented to siya. So, gi-organize siya according to the patient care department that provided care. So kato nga department ang mga health paper records dito sa who maintain it katong department na to that gives the care. So lahi-lahi ang ang health records in every department. Napoy problem-oriented health record format. So a documentation approach in which the physicians define each clinical problem individually and all documentations related to the clinical problem is stored together. So, kung source-oriented, nakabase sa patient, ang arrangement is by patient. Kani naman, ang arrangement will be based on problems or based on illness. So, ibig sabihin, in one illness, kay kuan to siya, na ay mga different patients. Kumbaga, yun ana pa. Sa source, in one patient, na siya mga lahi-lahi ng illness. Yun ana ang concept ba? Kung ikuan pa nato siya. Layman's term pa nato siya. Pero yun ana ang concept. Napoy, the third format is the integrated health record format. Organizes all the paper forms in strict chronological order and mixes the forms created by different departments. So naka-arrange lang dyan siya in chronological order. So that is the paper records. So ibig sabihin, for this, centralized ng integrated health record format. So in hybrid, mahitabo lang ni siya when there will be a transitions from paper-based records to electronic record. Ibig sabihin, naanay, duha ang na kay electronic record, pero as practice man God, when you kanang use electronic record, there should be kanang dual dapat ang magdagan ana in first years kay kay evaluation period pa man na sa ato ang electronic health record. So naadjud kay manual at the same time na atong imuhang computerized para and i-check man na nimo kung nagko-coincide ba ang imong record sa manual o sa electronic. So i-evaluate pa man nimo ang electronic nimo, so that's why hybrid ang mahitabo. So sabay sila. Then electronic records or EHR. So new formats, EHR systems, new format and functionality na daw bagong functions na for result management, na order entry or order management, na clinical decision support. So result management, having timely access to all types of results, including laboratory results, radiology results, and other test results. Over a period of time, helps providers make informed choice for diagnosis and search. So ibig sabihin, the EHR now, kay na daw results management. So kinsa usually ang users ato katong mga medtech makaron that will encode the test result or upload the images katumayon ana sa during the test kung ano mo results. Order entry or order management. So computerized provider order entry or CPOE systems provide physicians and other providers the ability to place order via the computer from any different locations and add decision support capability to enhance patients' safety. Unsa man ni siya, unsa man nga mga order, let's say for example, kani siya usually are ang user ani kay kuan na siya kana mga physicians, let's say for example, mag-issue siya og order for kanang laboratory test ni patient 100. So kana siya kay i-notify niya dito ang katong mga sa user sa laboratory department. Sa mao ni si patient 100 kay naa na siya mga blood test, naa siya unsa pa na siya urine test and x-ray nga mahitabo. So ang buhaton na lang is that wala na prescription nga ihatag si doctor kay kuan naman niya kuha naman niya sa CPOE. Kung ato na lang si patient dito, niya ihatag niya yung patient number or information, ma-identify na dira karon kung unsa man itong i-undergo nga test. Or even, order entry sa mga pharmacy sa kanang hospital pharmacy. Let's say, for example, naghatag prescription online. So, part of the CPOE, manggod kay kuan mga e-prescriptions na ginatawag nato. So, naghatag na gyapon og prescription si doctor. So, instead of manual prescription, so dito na lang sa CPOE, so ang ang nga directly connected to the kanang pharmacy na nag-institution. So, tanawon na lang dito kung unsa itong mga medication, mga medicines nga gi-prescribe ng isang doctor. So, that's actually part of the CPOE. So, pwedeng ganon. Pwedeng mo magbuhat ng inyong na system. Health-related. So, clinical decision support. Clinical decision support helps healthcare providers give effective and efficient patient care, review structured electronic data, and alert practitioners to outrange laboratory values or dangerous trends before problems become evident, recall relevant diagnostic criteria and treatment options on the basis of data recorded, and give instant access to pharmaceutical formulas, referral databases, and referral literature. So, anong ibig sabihin? Ang EHR now has the decision support na ginatawag na to. So, pwede ninyo actually ma-incorporate ang subject ni ma'am ninyo adlaon sa inyohang kanang subject sa iya. Pwede ninyo incorporate sa mga decision support tools, no? Such as kanang pattern analysis, clustering, unsa pa mga kanang association rules and many others. So pwede nimo na siyang ibutang dira sa imong decision support. So that ends our discussion for today. Do you have any questions? Murag koma. None, sir. None kay feeling nako nagkuan lang mo. Nagdula lang mo dira.
Awa, na po si sir, na sad.
Alangan.
Sir, kinaminaw man me.
Sure.
Oh, no. Oh, yes.
Sure ba? So anyways, if you don't have question, at least you have heard the idea now of what to do with your proposal kay inyong buhaton sa inyong system. Diba? Dako ang konsepto ni healthcare as related system. Pwede ka mo ato sa AHR sa tawag nito, institution based, or pwede ka dito sa patient. Pwede ka magbuhat og website, di ba, na i-record something. Pwede kang magbuhat og CPOE, no? Katong mga ingon ato for katong recording of test results, kana ingon ana. So pwede nang nimong ikuan dito, buhaton. Diba? So dapat as a group na anamoy, I want you, first task ninyo is conduct a meeting, then talk about what to develop na system, tapos identify unsa man ang mga capacity, no, functions of that, and who are the possible users. That would be your first task, and I want you to document it. Nagets ba?
What if, sir, kanang magdepende ang among system sa ihatag na information and gusto sa client, sir, sa
gani. Apil gani si client dito. Kaya naman din mo, tama, naman mo client. So, kuan.
Ang problema lang sa client, sir, kay dili din may makakonduct og meeting na ora-orada, sir, kay syempre nagtrabaho man.
Char, pero imong mamara siya Don, nag-ingon na
Nagtrabaho
ka.
gani sir, nagtrabaho gani sir.
Sa imuhang balay ra, kuhita man na imong mama, oy, hindi pamahaw.
Sir, ni duty na sir. Ni
Oh,
duty
eh,
na sir.
panihapon.
Panihapon,
Mm.
mga kuan sir, makauli mo siya mga 9.
Oh. Wala tani mo. Mura po, matulog kag alas 8
Ay, di,
doon.
kung mag-in, ay, sige sir. So, akong istoryahan ng client, tapos, kung sa may nastorya sa client, istorya lang sa akong grupo, ana
So,
na lang.
ikaw ang liaison. Oh, ikaw ang liaison.
Liaison. Gani sir.
Liaison officer ka ba?
Ah, sige, sige.
About sa interview, dili ko maghatag og interview questions because ang interview kay kuan, dili na siya close-ended questions. Open-ended question na, di ba? Nana siya sa inyong English. Nana sa SAD pod, mga open-ended questions and close-ended questions. Dili advisable to have close-ended question. Anong ibig sabihin? Katong ang question nimo kay kuan lang, na kay set of questions, tapos dito lang. Question 1, question 2, question 3. Kung open-ended, nakabase ang questions, next question based on the kanang answer of the previous questions. Yes, kamo mabuhat na ng Josil.
Josil. Alvarez. Alvarez?
Kuan? Julius? Wala si Julius karon.
Julius. Si Gino lang sir.
Jeno na siya no.
Gino, sorry, sir.
Kasi ikaw il doon na.
Questions! Kaya para mahuli na ta.
Sir, naman ang resources sa kwan sir, no?
Upload lang na ako. Wala na ako na-record karon. Sige lang.
Ay, yes, sir.
Gani, nag-live din si Jeno kagahapon. Kagabi
Oh,
eh.
nag-deal si Sir kagabi.
Tanaw ko kadali.
Ugod sa sir? Live? Ay.
Nag-split siya.
Live ko gahapon. Uy,
Nanay punta na si Mira, sir. O si Asma.
Sir, any PHR, no, pwede kang, katong mga COVID monitoring, something. Pwede, sigun sa. Basta related to healthcare service. Kinsa pa yung nangangutana doon?
Si Mira.
Asa man si Miras? Sir, unsa man Miras?
Miss you daw.
Ang ako alam, sir, kung sa'yo gusto ni Ermat, sir.
Oh,
Sa kayo
Dapat-
papa niya sa ko.
dapat na may picture sa imong mama nga nag-interview ka.
Oh! Kung saan lang interview siya, sir?
Doon ang gusto to si mong mama kay makagraduate ka.
Lahat na story hala.
I-live. Tama, i-live dapat ang interview. Ako mag-chat si Sir Kuan Miras. Kanang si Sir Ian.
Mahilak na si Mira, sir.
Dere jud ko sir na ako i-pick sa list of students last term. Ambot, ganun wala ka dito sa online.
Wala ka
One
papasa.
imposter among us, duha, si Kabagti also. So, wala na questions, manguli na ta. So, Kurt, Russell,
Yes, sir.
lead us the prayer.
Sige, sir. Let us pray in the name of the Father, Son, and Holy Spirit. Amen. Our most gracious Heavenly Living Father, thank you for this session, Lord, for this successful meeting with Sir, with our teacher. Nakalimutan ko, sir, sorry. Thank you for the knowledge, sir. Thank you, Lord, for guiding us, and thank you for this another day, Lord. This all as more in your name. Amen.
Amen. So ila-ila sa Kurt kay murag nagsalam ko magsulod
Dili,
una, di
dili,
ba?
sir. Kalimtanon, gigong name, sir. Pati sa akong mga amigos, sir. Huwag itong problema, sir.
Sir Rogelio, di ay.
Wishes.
Sorry kayo, sir. Sir Badja, kalimot ko. Karoon lang, sir.
Alright, so bye-bye everybody.
Goodbye, sir.
Bye, sir.
Bye, sir. Thank you, sir.
Thank you, sir.
Bye, sir.
Ah,
Bye, sir.